So it's cosmetic. It's not a life-saving procedure.
It's not like someone is sick and if you
Yeah.
don't do it.
Yeah.
This one is more of the way your image.
Yes, it's about the image. So, and when we say a butt lift, is simply that we are transferring fat from one part of the body to another part. So if you don't like to have a big tummy, you have lots of fat there. So why don't you remove that fat and put it in your butt so that the shape changes and you like the shape and you have this hourglass.
The hourglass effect.
Yeah, shape. Alright, so basically what you are doing is to transfer fat. And if you've seen fat before, you see that fat is just like liquid.
So you are not thinking about the solid fat.
No, it's not solid fat. It's not solid. It's like liquid. So what is done is that there is a device that would suck out the fat, which is actually what is done in liposuction, instead of liposuction. So that instrument sucks out the fat, and at the end of the procedure, you may have like 2 liters of fat. You get, so imagine that you have that cake 2 liters. So you have that amount of fat, and then you inject that fat elsewhere.
After being
you process it in it. Yeah. But basically, you are pushing fat into a space. The people that do these BBLs, the professionals, what they even do is that they do it under ultrasound. That means you are going to be using ultrasound to make sure that you are putting the fat in the right place, the exact right place. Now you already know. That's a very simple procedure as it sounds. Just take fat from somewhere, put it elsewhere, and design it, and then the fat will, in quotes, it will grow. It will gain its own blood supply and it will set in the place. It will be like it's your body. Because actually your body. But what are the issues with BBL? One is that free fat is not supposed to be found inside the blood vessel. Once there's free fat inside the blood vessel, then that thing can go to the lungs and block it, and then the person dies rapidly and suddenly. So that's number one problem. Number two problem is that fat that you are taking away from one part to another does not have its own blood supply.
Relying on pre-existing supply that I'll be able to tap from the blood supply on the existing space.
You know, like grafting, when you graft one tree, the stem, you graft it into something else. It's relying on So
you say whether it can take or not take.
Yes.
That's just.
So if it's not able to get that blood supply, maybe some infection gets into the picture, then you will now see a situation where the person has what we call raging sepsis. That means there's so much of infection in the system, and then you see it will look as if the part of the body is decomposing.
So living tissue, you need blood, you need nutrients. And it's the vessels that supply blood and that will carry nutrients and everything. So if the fat is not able to get nutrients, that part dies off. The surrounding structures too. And in the process, infection sets in, catastrophic events.
So basically, if you are able to avoid those 2 complications we talked about, you are almost home and dry with BBLs. It's very, you talk about the recovery, they will tell you things like you can't sit on your butt for 6 weeks, you have to recover, you have to, that's the very minimum. That's not so much that you need to go for you to have a successful procedure. So the question now is, should you have it? I think to answer that question, we need to find out how dangerous it is. Because when many people want to have surgical procedures, you know what they ask you? They say, doctor, what's the success rate? That's what they ask you. You want to have appendectomy. Say, what's the success rate of appendectomy? Sometimes I look at it like, the patients even die from appendectomy.
In Nigeria.
But that's just to tell you that's just to tell you that even though there's a chance of dying, the chances of dying from an appendectomy are actually quite However, when it comes to procedures like BBLs, the chances of mortality are quite high. And especially when you are doing something for cosmetic purposes. If you are doing something for treatment, if it's almost like, well, you don't have a choice.
Now, when you are doing something for treatment, you ask the question, if I do not get this procedure done, what will happen? So someone has a life-threatening thing that would kill the person.
Yes.
The person, if you don't do it, the person will die. But there's always the chance that if you do the procedure, the person might live.
Yes, the person might live. So you
weigh
can decide,
you weigh the risk. But if I don't do this procedure, death for sure. Yeah. If I do the procedure,
there's a chance of death, but there's a higher chance of living.
Well, with cosmetic surgeries like this BBL now, what are you weighing? What's the balance?
You are trying to weigh your feel good, the way you feel about your body
image perception.
Yes. You compare it with whether life is worth living. So do you really feel that if your body can't be better than this, that life is not worth living?
Yeah, I think that's a way to look at it actually. So if I don't look a certain way, if I don't have the flat tummy and the bottom, does it mean I can't have the quality of life?
Yes. Because I heard somebody talking about this BBL, and she said when she was going to go in for a BBL, she became scared, and had to tell her husband, in case I don't come out, please take care of the kids. And I'm like, really? Because of BBL? I mean, if it's that you want to, but that just tells you how people view themselves. And many times people say, oh, when you are doing the procedure, are you not doing it for men? Are you not? Women will come out and tell you it's not because they are doing it for men.
There's a way you feel.
Yes, it's because of the way they feel, about themselves.
Like, for example, you've had 3 kids. And you used to have a very flat tummy. Now you have this pouch coming out. You just don't feel good about it. But the question is,
so what length should you go to correct that?
And sometimes, the way I think sometimes is, okay, my body has gone through this transformation. I have 2 kids, by the way. If my body has gone through this transformation, and when I see the evidence, the things that have caused the transformation, it makes me feel good. It makes me feel good.
So why not? Why don't
you? Some people are not able to come to that terms. They just,
Yes, so people will argue with you that why don't you have that flat tummy? Right?
And at the same time,
and then you can look at it, and people will ask you that, wow, is this you?
Yeah.
You've had 3
and then you have 3 kids,
and you still have this?
Yeah, well, at the end of, and that's why it's up to whoever is doing it. We are not going to condemn you for doing BBL. If it makes you feel, if you think it's worth it, if it is going to be worth it, then the choice is yours. But you have to be armed with information. So you are going to do it from informed, having all the information that you need, not just blindly going to do it. And also know that talking about the professionals that get these things done, they are not necessarily they are cadres of doctors. We are consultants in our fields. So some of these cosmetic surgeries, in fact all of them, it doesn't have to be a consultant that will get it. Some of these, a medical officer, someone who just finished medical school, goes for a training, I don't know for how long, they can go for trainings in cosmetic medicine or something, get certified, and they can start to practice. Doesn't mean that person has had so much experience or yes, but there are plastic surgeons who actually do this too. Plastic surgeons, on the other hand, are doctors who have undergone residency training to become a consultant. It's different.
So there's going to be a difference.
There's going to be a difference.
Generally, the way you should look at plastic surgery is you are trying to make yourself more beautiful. So, and it can be from very, very simple things, like just adjusting the way your eyelid is. You go to your cosmetologist, they adjust your eyelashes, things like that. So, little by little, you do more things just to make yourself more beautiful. Now, the problem is, when you begin to do more complex procedures and there are complications, you need somebody who has a lot of experience with managing the way the body works itself. The body's response to certain conditions will make them manage you better, especially when there are complications. They were able to recognize that this is a complication and they are able to know what to do. But if it's someone who has just learned, you just look at it like this. Imagine that there's the engineer who has who made the engine of a car. Compare, that person would know a lot about the working of that engine because he has put the engine apart many times, put it together. Now compare with somebody who usually washes the engine and then sees that, oh, okay, the oil is supposed to be at this level, and that person just does a procedure. Do you think that person will be able to recognize problems with the engine?
Exactly. The whole human frame.
The whole frame. So that is actually the issue. So it's to do those procedures, like I have explained to you, it's very simple. You are just taking water from somewhere, putting it elsewhere. It's actually very simple, but when there are complications, what do you do?
In fact, you know what? Knowing the specialization or the difference between just a cosmetic doctor versus a plastic surgeon. A plastic surgeon, a person who has undergone residency training, they will be able to even risk stratify. There are you know that, oh, this patient, based on this personal history, based on this family history, based on this, I shouldn't do this. I should give this before the procedure is done. I should, go through. But someone who does not have that experience may not know how to risk stratify the patient. They just do everything for everybody the same way. And that's why training is very important. Residency training is very important. So let's even assume that you want to get this BBL done. You feel that your life depends on it. Probably advise you to seek a plastic surgeon to get it done, not just
anybody. So just make sure that
there are plastic surgeons out there that I know, that I even know who do also do cosmetic aspects of plastic surgery.
Okay, so what we are saying is that just make sure you don't trust anywhere. Make sure you know the credentials of whoever is doing it. Make sure you find out some information about those who have done it before.
No, the challenge is even now that the people that are very qualified, I mean the plastic surgeons themselves, some of them may not even want to do this.
Many of them may not want
many of them will not want to do this
because it's quite dangerous.
It's very dangerous. So I saw this popular plastic surgeon in the US who was asked that what he should name the top one procedure he wouldn't want to do. He mentioned BBL.
Yeah, because actually the association was, I think in the US, the Association of Plastic Surgeons were actually trying to ban BBLs because they are that dangerous.
Yeah.
Any procedure that the risk of death is unnecessarily high would actually be banned. So, I mean, and what they've done is they actually have some recommendations. For you to do a BBL in the US, there must be some criteria that must be met, either with your institution, with your level of expertise, and even with the gadgets that you have to do the BBL. Because if a patient dies when you do a BBL, they will probably sue you if you have not met all those criteria.
So they are stricter and all that.
Yeah.
But
in Nigeria, you don't have that kind of thing. It's just on social media you hear people shouting. Meanwhile, before they do the procedure, in many of these hospitals, they have explained to some of these people the risk of death. Because like I told you, I said somebody was saying bye to her husband. It means that they have explained the risk of death. So but when you are shouting on social media that hospital is a useless hospital, they just bring everything and tell you that they've done everything. Meanwhile, we don't have so much of oversight such that some of all these agencies will go and check how it was done. Because the fact that you have signed a paper doesn't mean that you can still not
absorb of any.
But because people don't really have time for all those things.
And I think it's high time for maybe I don't know, the association of maybe plastic surgeons in Nigeria come together, bring up regulations as to the practice of cosmetic surgery in Nigeria, in the Nigerian context. We need to find a way to regulate these things. You see, I even see uneducated people who don't are not even in the medical line, open shops to say they are injecting this, injecting that.
They are injecting stuff.
What are these plastic surgeons looking at, or whatever? I don't know.
This is Nigeria. When you talk about plastic surgery,
and that's why we're advocating now.
This is in the hospital where you have somebody who is not even a trained doctor, is not a trained nurse, who tries to carry out surgical procedures.
Well,
we've not even taken care of those ones.
Not now talk of all this.
Anyway, but the minimum we can do is to give you this information and hope that you make informed choices. Alright. So catch you some other time.
Yeah, catch you. You're beautiful no matter what.
I'm beautiful no matter what. You're handsome. Maybe men too. Start giving one. But men don't do so.
Well, but men they started doing six-pack implants.
The problem is
six-pack implants.
Women are not the problem.
We're special. Bye.